Welcome to UICC On Air and to this session, Financing for Cervical Cancer Elimination, Global, Regional and National Perspectives. And this is in the build-up to and at the World Cancer Leaders Summit 2021. My name is Charles Goddard. I'm Editorial Director at the Economist Group. For the very first time as a global health community, there is an opportunity to eliminate a particular cancer. In November last year, in 2020, the World Health Organization launched the global strategy to eliminate cervical cancer. And I think really marking a quite pivotal moment in this process of trying to accelerate action and save lives. But of course, eliminating cervical cancer is by no means simple or straightforward. 90% of the deaths from cervical cancer occur in low and middle income countries. And I'm not really sure that there can be a starker reminder than this disease of the huge inequities that exist in access to healthcare across the world. The number of cases, too, in these countries are almost double that of wealthier countries. And while I think we're all aware that cervical cancer is eminently preventable and eminently treatable, the countries most affected are also those most without access to interventions and technologies to prevent, diagnose and treat cervical cancer. So the global strategy revolves around the so-called 90-70-90 targets. Those are due by 2030, and I'll ask my colleague in a minute to just run through those. But these goals will certainly require an enormous amount of political will, as the World Health Organization has said, extraordinary partnerships, universal health coverage that allows better and equitable access to healthcare. And it will require really effective mobilization of resources, and in particular, financing resources. And that is broadly the focus of this session today. We'll begin with a global perspective brought to us by my colleague Rohit Sahgal. Rohit is Principal for Global Health in Asia at the Economist Intelligence Unit. And Rohit's going to highlight some of the high-level challenges and opportunities for the financing of cervical cancer elimination, particularly in low-resource settings. And these findings are from a recent report that we've done, commissioned by UICC as part of the Unitaid-funded Success Project on the scale-up of secondary prevention strategies on cervical cancer, a project led by Expertise France and delivered in partnership with JPIGO, a Johns Hopkins-based NGO. We will then move from Rohit to from our global perspective to a regional perspective from Francophone Africa, where we welcome the Minister of Health from Burkina Faso. And then finally, we move across the world, where we are in Asia, Rohit and myself, to the Philippines, where we'll hear from the Department of Health about the opportunity that universal health coverage offers to drive progress on cancer and cervical cancer elimination. So let's begin, shall we, with a presentation and thoughts from the Economist Intelligence Unit. Let me hand over to you, Rohit Sahgal, the Principal for Global Health in Asia. Rohit, over to you.
Thank you. Thanks, Charlie. The study in particular has a background which is worth reviewing, and that is part of WHO's global strategy, as Charlie was outlining. The strategy to accelerate elimination of cancer, cervical cancer, as a public health burden, fundamentally focused on three priorities for the coming decade. A vision of a world where cervical cancer is effectively eliminated and as a public health problem no longer holds that burden. A threshold of 4 per 100,000 women years for elimination as a public health problem in itself. And the following 90-70-90 targets, which is a fundamental core that must be met by 2030 for countries to be on that path towards cervical cancer elimination. Now, what does that really mean? And I think breaking that part down in terms of the 90 part is where 90% of girls would be fully vaccinated with HPV vaccine by 15 years of age. The 70% would be the women who are screened with a high performance test by at least 35 years of age, and again, at the age of 45. And the 90 again is the percentage of women identified with cervical disease who receive treatment. And that's a fundamental breakdown in terms of 90% of women with pre-cancer treated and 90% of women with invasive cancer managed. And these are vital backgrounds as we moved into the report in itself. The context of the report was really to address these specific challenges in what would help implement those goals that were being set by the World Health Organization, particularly around low resource settings. And it outlined 4 priorities for policy and financing decision makers to engage with. And these are the 4 priorities that really sort of broke down for us, where a lot of the attention and focus needed to be had. What was the methodology that we followed? The EIU conducted a fairly extensive and rigorous review of indexed and, most importantly, gray literature carried out in-depth interviews that were with global experts across a variety of different expertise, from disease elimination, international development, and health finance. Looking at it also from aggregation of data and the expertise that was reviewed, we prepared a report on the challenges that are facing policymakers in low resource settings, particularly around implementation of the WHO's global strategy goals that were being outlined. The research was commissioned by UICC as a product of the Scale Up Cervical Cancer Elimination with Secondary Prevention Strategy project, and it was led by Expertise France and funded by Unitaid. The 4 priorities that really broke down, and this is providing a summary of that. The first priority that came out quite clearly is that the need to generate local data that would help inform health financing design and decision making. It's a need that became quite urgent as we looked at the types of in-depth understanding of what sort of epidemiology and barriers to screening were existing at this point, and the follow-up at the country level. The local data is also needed to identify those highest impact and most sustainable solutions in a given national or subnational context. So there's really no one-size-fits-all magic pill in terms of finding and generating that local data, and the importance of that in giving the right information for the right decisions around health financing design and ultimately decision-making is a fundamental as a first priority. The second priority was leveraging the World Health Organization's costing and modeling tools that would ultimately and fundamentally define and assess national funding and the extent of service availability. And also at the same time, developing feasible stepwise plans that would help scale up funding, looking at the types of services, and more importantly, the quality of services. These two, in terms of the generating of local data and leveraging what the World Health Organization's costing and modeling tools were able to provide, led us to a third priority. And that was championing integration at a variety of levels. Policy, the ability for there to be sound policy that's decided and fundamentally driven, the financing, flexibilities and opportunities, and even innovation, the program and service levels that would also ensure success and sustainability across the platforms. And how was that sort of coming through? Well, the compartmentalizing approaches to specific public health goals were yielding inefficiencies. There wasn't necessarily enough in terms of cross-sharing and cross-pollination that would allow for a more efficient integration to be coming through. And the policy, financing, the program and service levels were needing a further integration value. Those integrating interventions with regards to various health goals, so for instance, cervical cancer, HIV, reproductive health services, was reducing resource duplication and avoidable costs as well. And the fourth priority for policymakers was looking at utilizing innovative and blended finance solutions to complement domestic funding. Now, insufficiency of domestic funding availability and fundamentally the impact of the ongoing COVID-19 pandemic on external funding is going to strain funding availability. And that is something which is coming across loud and clear. At the same time, domestic taxation, the socialized healthcare and development banks blended finance, and the private sector need to be considered. These are important voices and contributors in the ability for there to be innovative and blended finance solutions. And really, in terms of the finance solutions and balancing that between sources needs to be catered to the specific conditions of a particular country or an area. And altogether, the four priorities that were coming together began to paint a very clear dynamic and a picture that not just in terms of integration value, not just in terms of innovative finance and the need for finance solutions to be looking at coming together, but at a national and subnational level, these are now critical factors that need to be now defined and moved further.
Thank you, Rohit, very much indeed for running us through those findings. Do please read this report as it highlights, I think, for me and for those of us that put it together, particularly the importance, as Rohit was saying, of really championing the integration as a policy, at a policy financing program and service level in order to be able to at least ensure a greater level of success in tackling cervical cancer. The next speaker, Charlemagne Ouidri Ogo, who is the Minister of Health from Burkina Faso, has been involved in exploring innovative regional partnerships among Francophone countries in Africa to support the global strategy for the elimination of cervical cancer. Minister, thank you for joining us. The floor is yours. Thank you.
Merci beaucoup, merci de me passer la parole. Je me réjouis de revoir un certain nombre de personnes que je n'ai pas vues il y a longtemps et de parler du cancer du col de l'utérus au Burkina, le combat que nous avons engagé depuis plusieurs années pour lutter contre ce mal et surtout à travers des actions de prévention. Alors, comme vous le savez, l'épidémiologie du cancer du col de l'utérus au Burkina est connue sur la base des statistiques qui sont données par Globocan. Tout simplement parce que nous n'avons pas encore mis en place un registre national de cancer du col, du cancer en général, qui nous permet d'avoir les statistiques. Et on voit bien à travers les statistiques de Globocan que le cancer du col de l'utérus est le troisième cancer le plus fréquent et le deuxième cancer le plus fréquent chez les femmes. Si nous regardons dans notre background ce que nous avons fait au Burkina depuis quelques années pour lutter contre le cancer du col, nous pouvons dire que nous avons mis en place un programme national de lutte contre le cancer du sein et contre le cancer en général au niveau de la direction de la prévention et du contrôle des maladies non transmissibles depuis 2017. Et avec le président Roch-Marc Christian Kaboré, il y a eu des mesures de gratuité en faveur donc, des femmes et des enfants de moins de 5 ans. Et dans ces mesures de gratuité de soins, nous avons inclus la gratuité du dépistage et la prise en charge des lésions précancéreuses du col de l'utérus. Concomitamment, nous avons réalisé une campagne de démonstration de l'utilisation du vaccin contre le HPV chez les filles. Il s'agissait d'une expérience pilote qui a été réalisée dans 2 districts en 2014 et en 2015 et qui nous a permis d'avoir des résultats tout à fait satisfaisants. Toujours au Burkina, nous avons pu élaborer donc des directives nationales de prévention et des modules nationaux de formation pour le dépistage et la prise en charge des lésions précancéreuses du col de l'utérus. Nous avons également mis en œuvre 2 projets de prévention secondaire du cancer du col de l'utérus centrés sur la détection du virus, du papillomavirus, avec la contribution de l'ONG Médecins du Monde dans le district sanitaire de Basse-Cuisse, c'est-à-dire dans la ville de Ouagadougou, et également en collaboration avec l'ONG américaine JHPIEGO. Et cette fois-ci, ça s'est réalisé dans 5 régions du Burkina Faso. Toujours dans le cadre de la lutte contre le cancer en général, nous avons pu mettre en place et nous l'avons rendu fonctionnel un centre de radiothérapie pour traiter tous les cancers en général et en particulier le cancer du col de l'utérus à travers donc la brachythérapie. Et au Burkina Faso, nous avons une très forte implication de la société civile qui œuvre aux côtés du ministère de la Santé pour lutter contre le cancer du col à travers donc des actions de prévention. En ce qui concerne les perspectives, et que ce sont des perspectives à court terme, nous envisageons bientôt, parce que nous avons eu l'accord du ministère de l'Économie et des Finances, pour créer le Conseil national de lutte contre le cancer qu'on appellera CONALUCA, assorti d'un secrétariat permanent qui s'appellera CPLUCA, dont la mission sera de lutter contre le cancer en général et le cancer du col de l'utérus en particulier. Nous comptons également introduire le vaccin contre le HPV dans le programme élargi de vaccination et au cours de cette année même, vers la fin de l'année. Comme vous le savez, le Burkina est un pays champion en matière de vaccination. Nous avons eu une expérience de 40 ans de programme élargi de vaccination. Et donc, c'est une expérience qui nous permet d'introduire facilement le vaccin contre le HPV pour pouvoir prévenir le cancer du col chez les jeunes filles. Nous allons acquérir dans les mois qui suivent 15 unités mobiles pour le dépistage et la prise en charge des lésions précancéreuses. Il y aura une unité mobile par région sanitaire parce que le Burkina en compte 13 régions sanitaires et c'est un financement qui a été acquis par la BID et aussi avec la contribution de la Fondation Gate. Nous allons élaborer une stratégie nationale d'élimination du cancer du col de l'utérus et nous envisageons également créer un centre de formation et de prise en charge des cancers gynécologiques. Alors, le Burkina a pris un certain nombre d'engagements à l'international qui se matérialisent par des actions pratiques au Burkina. Nous avons adhéré à la stratégie mondiale d'élimination du cancer du col de l'utérus et nous comptons, à travers cet engagement, faire en sorte que 90% des filles soient complètement vaccinées contre le HPV avant 15 ans, 70% des femmes bénéficient d'un test de dépistage de haute précision à l'âge de 35 et 45 ans et 90% des femmes atteintes d'une maladie cervicale doivent recevoir également un traitement. Nous avons, comme nous l'avons déjà dit, une mobilisation importante de la société civile aux côtés du ministère de la Santé avec le leadership de l'épouse de son Excellence, Monsieur le Président du Faso, qui est la présidente de la Fondation Kimi et qui a autour d'elle un certain nombre d'ONG qui relèvent la société civile qui l'accompagne et pour faire poser des bases, des actions en faveur de la lutte contre le cancer du col de l'utérus au Burkina Faso. Et notre première dame est également très active au niveau de l'Organisation des premières dames d'Afrique pour le développement, OPDAD. Et à ce niveau, elle partage l'expérience du Burkina, mais aussi son engagement, non seulement au Burkina, mais en Afrique et sur le plan international. Et récemment, nous avons participé au Forum Génération Égalité et il était également question de parler de la santé sexuelle et reproductive qui inclut justement la lutte contre le cancer du col de l'utérus. Et le Burkina a animé la 3e coalition aux côtés donc d'un certain nombre de pays tels que la Macédoine du Nord, la France, le Danemark et l'Argentine. Et nous nous sommes rendus à Paris pour participer en format hybride à ce forum Génération Égalité, mais aussi nous avons manifesté au Burkina Faso à travers les 13 régions sanitaires. Et nous avons mobilisé des femmes et des hommes qui ont suivi le forum Génération Égalité en visuel à partir donc de leur région. Et au cours de ce forum, il a été encore réaffirmé notre engagement à participer à la stratégie mondiale d'élimination du cancer du col de l'utérus. Et tout cela, il participera pour l'émergence d'un monde égalitaire femmes et hommes. Il y a un certain nombre d'opportunités de partenariat sous-régional que nous avons saisies et nous avons participé à la réunion de Dakar qui s'est tenue du 13 au 14 juin en 2019. Il s'agissait d'un atelier sur les cancers féminins en Afrique et au cours donc de cet atelier, il a été jeté donc les bases d'un partenariat sous-régional pour l'élimination du cancer du col de l'utérus en Afrique, à l'image donc du partenariat de Ouagadougou qui s'occupe de la planification familiale. À Dakar, il y a eu un certain nombre de recommandations qui ont été émises. Il s'agissait de mettre en place un réseau virtuel de l'ensemble des participants à l'atelier en vue de disposer d'une première plateforme de préparation du partenariat et de cartographier les activités existantes en vue de les renforcer et d'identifier les synergies. Cette plateforme pourrait également initier un partage de bonnes pratiques des pays pilotes. Il a été dit également qu'il fallait initier une réflexion sur la définition d'une feuille de route commune à l'ensemble des pays de cette plateforme et d'établir ou identifier des coalitions au niveau des pays pour que tous les pays disposent d'une stratégie budgétisée pour faire avancer les programmes et attentes des parties prenantes et des indicateurs communs. Il est également proposé de mettre à disposition donc, de l'équipe une assistance technique pour la mise en place de ce partenariat et à plus ou moins long terme des stratégies nationales pour la lutte contre les cancers féminins. Il est également recommandé de cartographier les donateurs susceptibles d'être intéressés par ce projet de partenariat et en collaboration avec l'OMS et les autres partenaires techniques et financiers et l'UICC. La mise en œuvre de ces recommandations de l'atelier de Dakar, nous pensons que ça permettra de mettre en place un véritable partenariat sous-régional en faveur de l'objectif d'élimination du cancer du col de l'utérus. Voilà donc ce que j'avais à dire pour le Burkina, en disant qu'au niveau du Burkina, nous avons un atout. De plus en plus, il y a une émergence des organisations de la société civile pour lutter contre le cancer en général, avec un accent particulier sur le cancer du col de l'utérus. Et ces organisations de la société civile se sont réunies et ont créé ce qu'on appelle la coalition burkinabé de lutte contre le cancer, qu'on appelle OBUCAN. Et cette coalition a été reconnue administrativement par les autorités du Burkina. La Fondation Kimi assure le leadership de cette coalition et les activités sont déjà en cours avec une collaboration parfaite avec l'UICC et des master courses sont en train donc d'être mis en œuvre pour renforcer les capacités des membres afin qu'ils puissent ensemble poser des actes qui permettront de mobiliser les femmes autour d'un dépistage massif et actif et aussi aux prestataires d'être disponibles pour prendre en charge les lésions précancéreuses et orienter vers les services appropriés les femmes qui souffriront donc du cancer du col avéré. Voici ce que j'avais à vous dire ce matin sur notre engagement pour lutter contre le cancer du col de l'utérus au Burkina Faso. Je vous remercie.
Merci, Minister. Thank you very much, Minister, for your thoughts and your perspectives from your region, particularly around partnerships and collaboration, as you've just run us through, in a region, of course, where the burden of cervical and indeed the burden of breast cancer is one of the highest in the world. So we now move to Asia, back to this region where both myself and Rohit and Clarita Cairo, who's just about to speak, are. And we're going to hear from the Philippines, where Clarita Urbino Cairo is the medical officer and program manager at the Department of Health in the Philippines, where they are seeking to leverage the progress and commitment to universal health coverage at the national level to move towards the cervical cancer elimination targets. And Clarito, thank you very much for joining us and welcome. Could you give us your thoughts and your ideas around this? And indeed, let me hand the discussion over to you.
Very much, Charles. Good morning, good afternoon, and good evening, everyone. I'll be sharing with you the experience of the Philippines in addressing cervical cancer as a global public health burden. Next, please. So here are some quick facts on cervical cancer in the Philippines. It is one of the most preventable and treatable forms of cancer. There are about 35.6 million Filipino women who are at risk. And annually, there are about 7,190 new cases of cervical cancer and about 4,088 cervical cancer deaths. Hence, there are about 11 Filipino women who are dying of cervical cancer daily. And cervical cancer is the second most common woman cancer next to breast cancer. And it's the leading cause of death among women living with HIV. Next, please. So we are very grateful and honored to be selected as one of the 4 project countries of success. Success stands for Scale Up Cervical Cancer Elimination with Secondary Prevention Strategy. It's a project handled by the Consortium of Expertise France, JPIGO, UICC, NIH, NCI, INCA. So we are very thankful that we are selected as the, shall we call it, one of the pilot sites for this project. It will boost our campaign to fight cervical cancer in our country. Next, please. So on April 12, 2021, the Department of Health of the Philippines and JPIGO Philippines, as the representative of the Consortium of Success Project, forged a partnership. So we have this memorandum of agreement, and we have these areas of cooperation that are aligned with the expected outcomes of the Success Project. Next, please. Here are the expected outcomes. Number 1, informed national plan for scaling up cervical cancer screening and pre-cancer treatment through the conduct of implementation research. Number 2, increase awareness of and demand for cervical cancer screening in and outside the country, involving the community, partner with civil society groups, people living with HIV or women living with HIV, and cancer societies. Number 3, adapted and integrated service delivery model for cervical cancer screening and treatment for precancerous lesions. And number 4, created conditions for regional and global scale-up through inclusion of cervical cancer secondary prevention strategies, particularly in universal health care and social protection. Next, please. So we identified this timeline for the elimination of cervical cancer in the Philippines. We have 3 phases. So this will be a progressive realization on our part. For the phase 1, from 2021 until 2024, we will be launching the Cancer Supportive Care and Palliative Care Medicines Access Program. So this July, it will start. We will be providing free medicines for cervical cancer. We have these eligible patients who are entitled to receive free medicines for supportive care and palliative care. And number 2, we will be rolling out and implement the Success Project. It's ongoing. We already formed the Joint Project Implementation Committee for 3 years. So the project will run for 3 years in the country. And next, we will be institutionalizing the screen and treat approach using the HPV DNA test and the use of thermal ablation for the treatment of precancerous lesions. And we will also be expanding the HPV vaccination among the 11-year-old girls. And hopefully, we will be embarking on the 1-dose HPV vaccination, gender sensitive. It's currently being reviewed by our Health Technology Assessment Council. And lastly, for phase 1, we will strengthen the Healthy Lifestyle Program, which will address the 4 major risk factors like the tobacco use, the harmful use of alcohol, physical inactivity, and unhealthy diet. So for phase 2, from 2025 to 2027, we need to scale up a screen and treat approach. If we can cover the entire country, the better. And then we will also be expanding the HPV vaccination and the CISP-MAP, the Cancer Supportive Care and Palliative Care Medicines Access Program, meaning we will increase the budget. And if we will increase the budget, there will be many more patients that will benefit from the free medicines. And for the last phase, we hope to achieve the 90, 70, 90 targets of cervical cancer elimination. Next, please. So we need to have this budget for the interventions on cervical cancer elimination. For this slide, as you can see, for the past, let's say, 3 to 4 years, we are focused mostly on breast and childhood cancer. But starting this year, 2021, we will include cervical cancer in our Cancer Supportive Care and Palliative Care Medicines Access Program. Plus, for the screening or early diagnosis, we will also promote the availment of VIA and pap smear and even HPV DNA testing. And the malasakit centers, there are about 127 nationwide. They have a budget, let's say, more than $20 million just for the conduct of the screening tests or early diagnosis, including the treatment of pre-malignant lesions using, let's say, thermal ablation, while Success Project is ongoing. And then we allocated for this year $15.12 million for all the priority treatable or curable cancers, including cervical cancer, of course. And for next year, 2022, we will be allocating $16 million. So by, let's say, by 2023, we will be reaching maybe $20 million just for the free cancer medicines. And of course, there will be a separate budget for screening and early diagnosis and treatment of pre-malignant lesions on top of our National Health Insurance Program or PhilHealth, because we have this insurance program which is still hospital-based. And we hope to expand the services of our health insurance program by 2024, 2025 to cover outpatient interventions or services. I think that's all for me. Thank you very much.
Clarito, thank you very much. As people may or may not be aware, the Philippines has brought both the Universal Health Coverage Act to life, as well as the National Integrated Cancer Care Act, both of which are now in effect operating alongside each other. I'll come to that in a moment, Clarito, if I can, but we've got a few minutes left, and I just want to take this opportunity to ask a question of each of the panelists here. And I'll start with Rohit, if I can, Rohit Sagal. Rohit, I mean, our report, as you mentioned, offers 4 key priority areas. What do you see? I mean, we've been a year into the global strategy now. What do you see as perhaps being the key priority, the most important finding that we had, and how would we take that forward at this point?
Thanks for that, Charlie. And I think hearing Dr. Clarito's session and the ministers as well, I think it also reinforces the fact that in our report we were realizing one of the largest issues being the need for innovative and blended finance solutions that will really help the current insufficiency of domestic funding availability and the impact that will have, particularly on the 90, 70, 90 goals. If they're to be realistically achieved, the need for there to be these blended finance solutions absolutely have to be something that that we need to look at much, much closer.
And out of those, I mean, obviously we've been talking about the coming together, the consortium approach of different kinds of banks, both private sector and multilateral. Is that feasible? Is that something that we can see happening relatively easily?
Easily we'll have to probably look deeper into, but the value that there can be a champion or a championship of integration at various levels, policy or financing, the program and service levels, the consortium level value that can come together can actually make that happen. So rather than this compartmentalizing of the issues, building and bridging some of those together to achieve the public health goals is ultimately going to take us to where we need to be, and creating these more blended finance solutions, and necessary ones at that.
Minister, thank you very much indeed for your thoughts. What would, you spoke about the regional participation, the regional collaboration and partnerships that are so important to try to address cancers, women's cancers particularly, and cervical cancer elimination. What do you feel would be the most important next step and opportunity to advance this progress towards cervical cancer elimination, particularly at the regional level?
Alors, je pense que les prochaines étapes seraient déjà, comme nous l'avons dit, qu'il y ait déjà une plateforme pour que nous puissions partager les expériences et harmoniser donc la marche vers l'élimination du cancer du col de l'utérus. Et cela passe par non seulement la vaccination contre le HPV, mais aussi le dépistage des lésions précancéreuses et leur prise en charge immédiatement au cours des consultations. Et ces deux actions cumulées vont permettre non seulement aux femmes qui sont déjà en contact avec le HPV d'être sûres que leurs lésions précancéreuses seront soignées et ne pas faire l'évolution vers le cancer, mais aussi aux jeunes filles de bénéficier donc du vaccin et être protégées donc contre les génotypes cancéreux de HPV. Donc, ceci est très important. Et pour que l'ensemble des pays puissent partager leurs expériences dans cette démarche-là, il faudra que la plateforme soit très active, à l'image de la plateforme du partenariat de Ouagadougou pour la planification familiale, afin que chaque pays puisse bénéficier de l'expérience des uns et des autres pour que sa feuille de route de l'élimination du cancer du col soit une effectivité. Merci.
Merci, Minister. Thank you very much, Minister. And let me turn now to Clarito Cairo. And Clarito, thank you for sharing your thoughts earlier. How important, Clarito, do you think the passage of the Universal Health Coverage Law has been for helping to accelerate progress towards cervical cancer elimination in the Philippines?
Charles, actually, what will, let's say, drive or help in the elimination of cervical cancer is the National Integrated Cancer Control Act. We have the Republic Act number 11215, alongside with the Universal Healthcare Act, Republic Act number 11223. So it's not just the Universal Healthcare Law, but we also have this cancer law. They are both signed in 2019. So I think with that cancer law, we are now privileged to have this budget every year. We secured the budget for cancer control program, and that will help us with our interventions for cervical cancer elimination. As just like what I showed you, the three-phase timeline for the elimination of cervical cancer.
And obviously there are going to be benefits and disadvantages of having two laws that cover sort of roughly some similar areas in that.
They complement, actually, they complement and supplement each other.
Excellent. Okay. And from a financing point of view, obviously there's limited financing for all of this. You're confident that the cancer law will be able to draw the financing in to help push the program on cervical cancer forward?
Definitely. In the financing aspect, the cancer law is a big help because universal healthcare law will cover almost all diseases, including COVID-19. Imagine for next year, our government allocated $2.12 billion just for COVID-19 vaccines. So imagine if there is no cancer law, then the cancer control program will be greatly affected
by that budget allocated for COVID-19 vaccine.
Well, thank you very much indeed. I'd like to thank all of the three speakers that have joined us today. Rohit Sagal, obviously from the Economist Intelligence Unit, Charlemagne Ouedraogo, who is the Minister for Health from Burkina Faso, and Clarita Urbino Cairo, who is the Medical Officer and Program Manager at the Department of Health in the Philippines. Thank you all for your contributions and thoughts today. And this has been This has been the UICC On Air program, which is in the build up to and at the World Cancer Leaders Summit 2021. Thank you.